My first question is that we were treating acute myeloid leukemia with 7 and 3 in 1977. We are still doing the same in 2020. What is the best way forward to change it by 2030?
Well, um, there should be something significant to be added to the chemotherapy, so to be added to the cytotoxic therapy. So that alleviates the abnormally highly proliferative cells. But what makes that cells to form and to flourish in that system, we don't know yet all those details, so we need to figure them out quickly and interfere with those parameters, I think. What kind of soil allows those cells to flourish?
So more research is your answer.
Well, there's a missing information, I think. I think there's an area that science is still blindfolded in the biology.
Okay. There are 3.5 million papers at least written on cancer.
Mm.
Something like 135,000 in 2017 alone. But there's a staggering disconnect between great scientific insights and transition to improved therapy. What are we doing wrong, Özden?
I think it's too. Um, what are we doing wrong? There's a huge gap between the resources devoted to research and its reflection on patients' care. You can choose one way and say this is just too much resources wasted, but you don't know where to start cutting. And if you discourage people from working on the research, then you will miss the findings, the innovations. So I think I think we should choose the way to encourage people to do research and carry that some extra burden on that research that is not directly reflected on patients' care. But we should work on optimizing the way research is done, and I think, as I said before, there is a gap in the biology that we don't still know yet. We need to identify new areas of research to fill that gap, and so that all that research becomes more useful to the patient.
Excellent. Question number 3. The fact that children respond to the same treatment better than adults
Mm-hmm.
seems to suggest that the cancer biology is different, but it can also mean the host is different. Since most cancers increase with age, this means having good therapy may not matter because the host is decrepit. Your solution?
Rejuvenate the host.
Good one.
Well, I think there's ample research, solid enough that we should believe. With age, one of the things that happens with age is the proteins precipitate. So the three-dimensional structures of the proteins are critical for their proper function. And even if you focus on the DNA, what separates the two segments of the DNA, so that enzymes for replication working properly, I think all that machinery, if the proteins precipitate, they become more prone to mutations. That makes the cell more prone to mutations. We should find ways to rejuvenate the soil, I think.
Excellent. Question number 4. You have great knowledge and experience in the field. If you were given limitless resources to plan a cure for cancer, what will you do?
Oh, well, we need to open new horizons. I think it's already an ongoing collaboration, so biotechnology and medicine should work together. So we should look at the body as a system It's good to learn with reductionist approaches, but to have them have an impact on patient care, you need to put them in a system and interpret them in that way. So I would find measures to see what rejuvenates a body. So I think that is the missing part in medicine. So one revolution in medicine was by accessing the DNA. Now with next generation sequencing, I think how things have facilitated so significantly. I think the next revolution will be dealing with the soil. So, and we are not talking about it yet. Only like Eastern approaches like yoga, mind rehabilitation, they are touching a little bit, but I think it's a very superficial touch, and there is a level where that approach will really come together with the science we are talking about. So we are not close to that borderland yet, and there is a lot to accomplish in that area, I think.
Very interesting answer. My last question is a philosophical one.
Okay.
Offering patients with advanced stage non-curable cancer palliative but toxic treatments is a service or a disservice?
No, it can be both, and I think as a physician, one should discuss all the pros and cons of such therapies and make the patient really decide, share the responsibility. It's okay if somebody chooses not to receive them and not to experience the toxic side effects and die in peace. It's okay. Or one may choose to undergo through some of the horrifying periods of a toxic therapy, but live a few months longer and complete his leftover projects with his or her family or friends and then pass away. Either one is okay. So we should just openly discuss such options with the patient and make him decide or her.
Thank you so much for your thoughtful answers.
Oh, sure, my pleasure.
Really enjoyed. Thank you.